The Medigap Myth. If you are on Medicare, you've heard it. You gotta get Medigap. Sometimes it's called Medicare Supplement, but they are the same thing. It seems to be the first thing people who are about to turn 65 hear from everyone. Friends, family, insurance companies, TV, the radio. Not to mention the plethora of mail that's overstuffed your mailbox. How many calls have interrupted your dinner, date night, or even your sleep? Even when you're browsing the web or reading your email, everyone tells you you need a supplement. Why does everyone want to buy a Medicare supplement? Simple. Like everything, it's about the Benjamins. With all these people telling you what you need, this video will give you the knowledge to ask the right questions and may help you determine if you need a supplement. By the way, some sources like WebMD, Health Grades, and even some doctors believe as many as 6 out of 10 people who have a Medicare supplement don't need one and never will. That's not to say there's not a place for it, but like anything, it may not be the right thing for you. When you go to Medicare, generally you have 3 options. Option 1, Medicare A and B, and then buy a Part D drug plan to avoid the penalties. With this option, you pay a deductible and then a percentage of every cost that comes along. There are some limits like number of days in the hospital and some other outpatient limits that a very small percentage of the population ever reach, but this option is an expensive one and most people do not opt to just stick with traditional Medicare. Option 2 is the same as Option 1, but you then purchase the very thing this video is about, a Medicare supplement. Before we get into details, let's look at the basics of most Medicare supplement plans. 1. Plans start around $60 and go all the way up to several $100s at age 65. 2. Generally, a supplement will pay where traditional Medicare stops and help pay some or all of the remaining deductibles and percentage of co-insurance Medicare does not pay. 3. All plans increase in cost as you get older, and a plan that was $100 at age 65 can easily cost over $400 by age 80. 4. To avoid a penalty, you must keep a separate Part D drug plan, even if you don't take any drugs, because Medicare supplement plans do not include drug plans. 5. The lower the price, the higher the deductible on your supplement. 6. Supplements generally allow you to see any doctor that takes Medicare anywhere in the U.S. Option 3 is a Medicare Advantage plan, which is sometimes called Part C, and it combines your Part A, B Medicare, as well as a Part of D drug plan. It also includes many of the benefits of a supplement, and usually with many additional benefits a supplement doesn't have. These are all built into a single health plan called Medicare Advantage, and we'll talk more about this in a minute. So, who needs a Medicare supplement? 1. Someone who travels from state to state and sees regular doctors or specialists in multiple states on a regular basis. 2. A person who turns 65 who's very ill and knows in advance they will need lengthy hospital and outpatient needs in the immediate future. That's it. Thought the list would be longer? Most people do, and that's why we call it the Medigap Myth. So, what's the answer? For most people who don't need a supplement, Medicare Advantage is typically the answer. Let's look at Medicare Advantage plans. 1. There are plan options with a $0 premium and many other plans with very low premiums. 2. Many plans include $0 copays on most everything including doctors, specialists, hospitalization, surgeries, testing, labs, and more. 3. They include all the benefits from Medicare Part A, B, and most include a drug plan, meaning you don't have to pay a separate Part D premium. 4. Many plans include built-in dental, vision, hearing, and hearing aid coverage. 5. There are plans that offer free transportation to medical appointments. 6. Some plans include services like medical alert systems that notify emergency services and family in case of a fall or accident at no cost. 7. Many companies offer special needs plans which give extra benefits to individuals with chronic conditions like diabetes, COPD, end-stage renal disease, and more. There are more benefits in some plans and not others, and it varies by company and region. When looking into an Advantage plan, always use a broker. They can help guide you into a plan that fits your needs. Now let's look at the reasons some people think they need a supplement and why an Advantage plan may be a better option and in most cases a much more affordable one. People want the freedom to see any doctor that accepts Medicare. It's true that a Medicare Advantage plan does make you stay in network in most cases, but here's the facts. Doctors don't want to limit their options to a small group of patients. Because of this, you might find most or all of your doctors take a Medicare Advantage plan in your area. If you have or are thinking about purchasing a supplement because you travel, keep in mind that Medicare Advantage plans cover hospitalization, emergencies, and urgent care in most parts of the country as if you were in your hometown. You won't pay more because you're traveling, and unless you need a specific doctor or a specialist outside of your hometown, you don't really need a supplement. Reason 2 people buy a supplement is because a doctor is not a network on any of the Advantage plans in your area. If you're considering a supplement just to see 1 or 2 specific doctors, you're spending hundreds of dollars a month to do so. That's almost like paying a $200 copay, but instead of paying the doctor, you're giving the money to the insurance company. How can you save hundreds or thousands a year and still see a doctor you want to see, even if that doctor doesn't accept Medicare Advantage plans in your area? Simple. You see that doctor as a cash patient, likely for less than the cost of your monthly premium for an expensive supplement. In fact, you could probably see the specialist every month for a year and pay less than your premium. If you become a cash patient, your doctor can still make referrals, write prescriptions, or request testing even without being in your network. That brings us to reason 3, referrals. It's true that most Medicare Advantage plans require referrals for specialists, and some supplements do not. Here's the problem though. Even though a specialist may require an insurance referral on Medicare supplement plan, most all specialists still require a medical referral from another doctor, typically your primary care doctor. If you have to get a medical referral anyway, why spend hundreds or thousands of dollars a year more to save a few days of waiting for the referral? We mentioned all the added benefits of a Medicare Advantage plan, like dental, vision, hearing, emergency response systems, foot care, diabetic supplies, and so much more. But there are some additional benefits you may not have considered. When you're on a Medicare Advantage plan, doctors and specialists have built-in communication between each other to save them and you money and time. Did you know some doctors won't accept tests, images, and blood work from some other doctors and will force you to repeat the test, get blood drawn, or have more x-rays, CT scans, and MRIs so the doctor has their own test done? With a Medicare Advantage plan, you will typically not have to repeat the tests needlessly like this. When one of your doctors gets test results, the rest do also. You'll also typically get in to see a doctor faster with a Medicare Advantage plan once you're an established patient. Hopefully this video has helped you understand the nuances of both Medicare Supplement and Medicare Advantage plans, and we hope it'll help you make decisions and purchase the right option for you. As we said earlier, we always recommend using a broker. If you're not in one of the areas we serve, we'd be more than happy to find someone who is. If we have agents in your area, we're also happy to help you at no charge. Don't wait until the annual enrollment period to contact us. You may have options today. A broker can find out in a few minutes, but until we hear from you, we can help. We love helping people, and we never charge a dime to do it. We appreciate you taking the time to watch this video and wish you a happy and healthy day.